Hello, welcome to Pathagonia. This is Jay. Today we're going to use Kurt's notes to talk about Hirschsprung's disease. I hope you all are doing well, and before we begin, if you already haven't, check out Kurt's Notes, the website. It's got great resources including useful links, articles, quizzes, as well as his famous Kurt's Notes. Of note, his most recent note is respiratory cytology, so make sure to check that out if you already haven't. Without further ado, let's talk about Hirschsprung's disease. It's important for us to recognize this entity and what it looks like under the microscope, because if you are on call, you may get a frozen from pediatric surgery to whether you can rule out Hirschsprung's, which is the congenital absence of ganglion cells in both nerve plexus, your submucosal or Meissner plexus. And this plexus helps with secretions, control secretions, as well as blood flow. And then your myenteric plexus helps control motility, and it's between your inner muscle and outer muscle of your muscularis propria. And Hirschsprung's will lead to poor peristalsis and obstruction, which subsequently leads to proximal dilation and a narrowed spastic distal aganglionic segment. Because you have poor peristalsis, you're going to have failure to pass meconium, abdominal distension, constipation, and worst complication is you can get enterocolitis. And it always impacts the distal most part of the GI tract. And this is where understanding embryology is so helpful, because the anal rectal region is the furthest for the neurocrest cells to travel to become ganglion cells. So during that traveling, if any process for whatsoever reason or another is interrupted, then you'll have this aganglionic segment in your distal anal rectal region. So let's talk about the anal rectal region. First, you have your anus, and that's made up by squamous mucosa. Then you have your dentate line, which surgeons also visualize to help them assess anatomically where they are. And then you have a physiologic hypoganglionated segment that's around 2 centimeters but shorter in newborns. And remember, histologically, our layers of the bowel is divided into mucosa, submucosa. You have your muscularis propria, which has inner muscle and outer muscle layer. Here, this pink cell is your ganglion cell, and then here are your nerves. And in this physiologic hypoganglionic segment where it's inadequate to confirm the absence of ganglion cells, you'll have, as noted, absent a few ganglion cells. You'll have absent nerve hypertrophy or neural hypertrophy, but nerves may be more prominent. Nerve twigs are present, which are just small branchings of larger nerves. And then your Hirschsprung segment, as you know, you'll have the aganglionic portion. But not only that, you'll have neural hypertrophy, as you can see here. You'll have absent nerve twigs. And then your transition zone, you will have ganglion cells, but they'll be fewer. You'll have neural hypertrophy. You'll have nerve twigs. And then in your normal bowel, as you can see here, you have many more ganglion cells. You have absent nerve hypertrophy. You do have nerve twigs. All right, so what is the suction biopsy protocol? This is what the pediatric surgeon will do to help you diagnose whether there is Hirschsprung's or not, or to rule out Hirschsprung's. It's a preoperative rectal suction biopsies, and biopsies should be greater than 3 millimeters in diameter, and at least 1/3 of the thickness should be submucosa, as you can see here. And it should be greater than 2 centimeters above the dentate line to avoid that physiologic area of hypoganglionated segment. And multiple serial sections are examined initially. And if there are no ganglion cells, you order additional levels, 75 levels in fact, and calretin and IHC. Why calretin and IHC? Well, calretinin shows the granular staining of small intrinsic nerve twigs in mucosa and the muscularis mucosae normally, which are absent in Hirschsprungs, as you can recall here. And it also highlights ganglion cells and nerve bundles. And here is an example of Hirschsprungs where you don't see those nerve twigs in your muscularis mucosae. But here is a normal segment where you do see those small intrinsic nerve twigs in the mucosa and muscularis mucosae. What is neurohypertrophy? Because we talk about there is neurohypertrophy in Hirschsprungs and in the transition zone. It is when the submucosal nerves, the nerves here, are greater than 40 micrometers. And then of note, it's important for us to note that we associate those ganglion cells as very epithelioid cells with prominent nucleoli. But this is, you have to understand, this is only in mature adults or mature / adults. The immature ganglion cells, as you can see in infants, often have less Nissl substance, that granular substance, and have a higher NC ratio. So it's important to recognize that. And then neuronal markers like NSE, NU-N, and MAP2 can be helpful in confirming the presence of ganglion cells. So that was it for this counting of Hirschsprungs, and we hope you all have a rest of a good day, and we'll see you next time. Bye.